So now I'm going to demonstrate the blind or tactile method. We have here today a model, obviously with a live patient. We would have the whole patient. We would have a restrainer up near the cranial end of the patient, holding them in place with the caudal end of their body coming over a table with legs hanging down. Keeping in mind with a live patient, your legs would naturally separate and fall apart in a frog-like leg position. With these models, they're quite stiff, so you won't see that happening. So how I would start, I would put my exam gloves on. I would grab my clippers. How I'm fully prepping this patient would be for if we were keeping an indwelling urinary catheter in place for a period of time. If we're not doing that, the clipping itself would not be necessary unless you're dealing with a patient that is extremely hairy around the area. All of this, again, keeping in mind, is for keeping everything as sterile as possible when we're placing the catheter. So I would take my clippers, I would come around the vulva area, clipping away all that excess, and then I would actually get right into the folds of the vulva, clipping away all the hair from there. Because this is a model, I'm not going to actually clip the hair, but you get the idea of where we would be going. Once I'm done that, I'm going to take my chlorhexidine scrub, again, getting all around the vulva, getting into the vulvular folds, clearing out any debris that might be there so that it's nice and clean. Once that's completed, I'm going to grab my syringe with my sterile saline. For small to medium dogs, I'd probably use about 10 to 12 mils of sterile saline. For larger dogs, I might use upwards of 20 mils. What I'm doing with this is I'm going to be inserting it into the vulva, up into the vaginal area, because again, this is a model, I won't actually squirt this in, but I would then be squirting it in and letting it free flow out. The one thing I didn't mention was that I always have a towel or an absorbent pee pad on the floor, ready to collect any of that saline that's coming out, and then again, once we place the catheter and have urine flowing through. What I want to do before I actually demonstrate this is I just want to go over the anatomy with you and what you're going to be feeling as you insert your finger into the vulva. So we would be inserting in with our index finger. If you're right-handed, you would be using your right hand. If you're left-handed, you would be using your left hand. So I would be inserting in, and as I'm going in, what you're going to be feeling is the ischial arch. And as you come up over that and hooking your finger around, you'll then be able to feel the pubis. So I just wanted you to have an idea of the anatomy itself and what you're feeling as you're going in. So now that all of the cleaning and everything is done, I'm going to get ready with my sterile gloves. Opening up the package, discarding the other piece, and opening up the package in a sterile method. So just grabbing onto the edges, pulling that open, making sure to just touch the very edges of that paper to open everything up. Sometimes they will fall back over, so you have to kind of try and snap everything open so that it stays open for you. Because this area now is a sterile field, I can now take my sterile lubricant, drop it on the inside of my sterile field so that that's ready there for my catheter. I now can do one of two things. If I had an assistant or somebody with me that could open this package for me and pass it to me, I would have them do that after I gloved. But if not, and I just have to do this on my own, I would open my catheter package sterilely. So opening it away, just kind of like peeling a banana, remembering that the inside of my glove package is sterile. So I can, and again, this can get a little bit tricky, but you try to do the best that you can to keep that as low to your glove package as possible. Opening, peeling away, and allowing that catheter to just drop within the inside of your glove package. And this one's not going to cooperate so well because the packaging is tearing away. So I'm going to do my best to just grab the outside of the package without touching the inside to try and get that to fall nicely within my glove package. Okay, that obviously was not sterile. We will pretend that it was and that fell exactly as such into our package. I now then will glove. So remember from our earlier video, as Ashley said, the outside of this glove is going, or the glove that's facing up is the actual inside of the glove. So it's okay for me to touch this portion. So I'm going to grab that. Putting that glove on, grabbing onto the inside to pull it down. Now this hand is sterile, so I'm free to move this catheter as I need to out of my way, keeping it on the sterile inside of my packaging. I'm now going to reach down in on the inside of that glove, lifting it up and placing it onto this hand. Now that everything is sterile, I can now adjust my fingers as I need to get that glove in properly. So now I'm sterile, I'm remembering that. Now I can open my catheter. Most of the female Foley catheters will come with this inner wrapping, so you will need to take that out of that wrapping. Now for me, as I said, I'm right-handed. So I'm going to be using my right hand to palpate and feel as I go into the vulva and into the vaginal opening. So I'm going to coil my catheter around my left hand. I'm going to lube the end of that catheter with my sterile lubricant jelly that's on the inside of my packaging. Now, depending on what the size of your patient is, it's going to depend on what finger you're using for the tactile method. In a dog of this size, I feel comfortable using my index finger, so I will then take that and dip that into the sterile lubricant jelly. And now I'm ready to come to my patient and get the catheter inserted. So remembering my earlier comment of what we're going to be feeling as we go in through the vulva and up into the vaginal opening. Keeping in mind your anatomy, keeping in mind that there's a vaginal vault, which is basically a dead space that goes to nowhere, and then there is your actual opening that will lead you up to that urethral opening. Please keep in mind with this model, again, as I said, the legs are very tight and close together and are not falling apart. In your alive patient, the legs would be splayed apart and out of your way. So it's going to be very difficult for me to maintain sterility with this particular model patient. So please keep in mind with your live patient, you would not be wanting to touch your sterile gloved hand to any of the fur or inside of the legs at all. So for demonstration purposes, I'm just going to separate things here so it's easier for you to see. So taking my index finger, I'm inserting it into the vulva. That finger is staying completely upright, and I'm going up my ischial arch. And then I'm hooking my finger around, moving along the pubis, going up. My finger, again, for demonstration purposes, I'm going to show you, as I'm inside, is hooked like this. When I do that, I can now feel the papilla, which is right by the urethral opening. I keep my finger hooked at all times. Once I've got to that area, I feel where I need to be. My elbow comes up and keeps my arm in a straight line. I'm now going to take my catheter. Again, demonstration purposes, the legs would not be in the way like this. I take my catheter. I go underneath my index finger with that catheter, ensuring that I'm not touching any areas. I'm not touching any fur. As I'm going in, I'm running it along my gloved finger, going up and inside. When I keep my elbow up like this and my arm in a straight fashion, it causes that catheter to go exactly where it needs to go. Again, with this model, it's unlikely that I'm going to be able to feed a catheter of this size all the way in and where it needs to go. But keeping my catheter secure so that I'm not touching any areas. With this model, again, it makes it difficult to do that because the legs and everything are in the way, which they normally wouldn't be in the way. So feeding under my finger, all the way up and in. And again, this is for demonstration purposes. I'm just going to kind of feed this in because it won't go all the way. We're going to pretend that's now all the way in. It's fed into place underneath my finger comes out, my catheter is in. If we had a catheter that had a stylet in it, I would be removing my stylet at this point. I would be getting my syringe, my 60 cc catheter tip syringe, inserting it into the end here. I would be drawing out, 6 to 7 mils of discard, getting rid of that, connect my 60 cc catheter tip for collection, drawing that out, and I would then be passing it off to someone to put into our red top tube, which we'll show you in a moment. Now that everything is in, my hands no longer need to remain sterile. So I would then get my sterile saline syringe for my balloon, inserting it into the end, injecting that in, and then removing once the saline was in, and then I would give just a very gentle tug forward to secure that catheter in place in the correct position, and I would then be connecting my closed collection circuit to the end of this sterilely, again, keeping this end here as sterile as possible. Now, if I was using a speculum, instead of doing the tactile method, I would have at the beginning put sterile lube onto here. And again, I would be using the same method that I was using with my finger. I would be going up into the vulva, up the ischial arch, coming up along the pubis, and then opening up, and then advancing my catheter in that way. You can't visualize what the urethral opening looks in these models, but we do have a photograph here which demonstrates exactly what it is that you would be visualizing if you were looking with a speculum. The bottom larger area shows you the vaginal vault area. Up above with the small arrow shows you what the urethral opening would look like if visualized with a speculum.